Hi everyone, Dr. Amna Husain here, board certified pediatrician, board certified lactation consultant, and mom to 2 girls. Today we're going to talk about a very important topic here, drowning. And we're on the onset of summer and my girls are 4 and turning 1. Neither are excellent swimmers. In fact, the 1-year-old hasn't even been enrolled into swimming classes yet. We just got through a brutal winter in New Jersey. And I'm just like you guys. I want my girls to be good swimmers, but I'm very cognizant of the fact that they are not and not so yet. Even the 4-year-old, I would not trust her in water by herself, even if she was the best swimmer right now, just given the age. Parents are obviously really concerned about these topics, and as pediatricians, we want them to be aware of it. So in this video, we're going to talk about drowning, what really happens, what we can do if we do witness a drowning child, and what we can do to prevent that from happening in the future. Okay, so first of all, let's talk about what drowning means, because there's a lot of terms out there like near drowning and dry drowning. But in 2002, the World Congress put out a consensus statement saying that drowning is essentially a form of primary respiratory impairment that comes from submersion or immersion in a liquid medium. Now, this is a confusing part because drowning does not particularly imply death. Oftentimes when we hear that a child drowned, you would think that death follows. That's not really the case. That's why terms like near drowning shouldn't really exist. Instead, sometimes we actually use the term submersion injury in medicine to describe a drowning event that was not fatal or a non-fatal drowning event. And here's the thing about drowning in pediatrics. It's often unwitnessed. We obviously have the best intentions when it comes to safety for our children, but unfortunately, sometimes that doesn't happen. So let's first start with prevention strategies. One thing that the American Academy of Pediatrics really harps on, and I agree with completely, is having a good isolation fencing around the pool with a self-latching gate. That's important. And the isolation fencing around the pool really means that you're not including the fence around the house too. So you can go straight from the back door of the house into the pool. No, there needs to be a fence actually just around the pool. Preferably, you don't want a chain link fence because we know kids can scale that very easily. Pool alarms and pool covers are all great, but the American Academy of Pediatrics really emphasizes that these should not be used in place of or in lieu of a gate. Another important point is touch supervision. So let's say your child is swimming and the gate's open because they're supposed to be swimming, right? But you should be within an arm's touch of the child. Essentially, I always say you should be within an arm's length of any young child or inexperienced swimmer. That's very important. So for example, my 4-year-old would still fall within touch supervision. If possible, you should have appropriate rescue gear on site at all times. So if you go to a public pool, these are what lifeguards have as well. They have appropriate gear in addition to having somebody who is monitoring the pool at all times. So why is this important? Because typically drownings tend to be bimodal. So that is 2 times that we usually see in a child's life. When they're young, and then the second time, the bimodal point, would be when they're adolescents or teenagers, because adolescents can sometimes take riskier behaviors. So you want to be aware of that. Your young children need to be supervised, but your older children as well. They can potentially engage in behavior that we know may not be safe, and they need to have an eye out for them because we know these kinds of injuries can happen very quickly. Speaking of other children that are very important to focus on are children who have potentially cardiac syndromes like long QT, or children who may have seizure disorders. So we want them to always swim with supervision nearby. All right, so this may be triggering for some parents, but we're actually going to talk about what really happens when a child drowns. And remember, drowning is not always a fatal event, but I want you to understand what exactly is happening so we can talk about resuscitation and why our mode of resuscitation is so important. So usually drowning begins with a moment of panic. Panic leads to you either breathing faster or breathing slower. Typically, you hear of hyperventilation or breathing faster. With that comes gulping in of water. You gulp in water and you actually can get something that we call a laryngospasm, or a spasm as the water reaches the respiratory tract, because you're not supposed to have water in your respiratory tract. That can lead to basically an impairment in your oxygenation. Now, I'll be honest, things that don't really matter as much are fresh water, salt water. Those types of questions are really not as important when it comes to resuscitation on the medical end. We definitely do ask about the age of the child, swimming experience, how long we think they might have been submerged, what the temperature of the water was, if any resuscitation was done. Those are all really important questions that we would ask at the time when they are brought into the medical facility. Generally, we do think that salt water, fresh water, that doesn't play as much of an important role as we once used to think. So let's talk about resuscitation briefly. This will not necessarily be a CPR course. However, I do have a YouTube Shorts video in which I go through primary CPR for an infant or child. I highly recommend you check that out. I'm going to link it here. But in this case, you often hear about compressions, airway, breathing, or CAB, when it comes to trying to resuscitate a child. Now in this case, we understand that the primary impairment is really respiratory. So you do want to establish and try to provide breaths early on. This is a difference from typical CPR. So the AHA, or the American Heart Association, recommends that rescuers provide 2 rescue breaths before beginning compressions for a drowning victim. Breaths can be given mouth to nose or mouth to mouth. You just want to be able to try to form a tight seal. Another important thing to remember is victims of drowning might actually begin to vomit or experience vomiting once you begin chest compressions. If that's the case, turn them over onto their side immediately. Now, if the victim is able to be resuscitated at the scene, amazing, but you would still absolutely need to go to the hospital. Call 911, go to the hospital, because we need to actually observe these children for 6 to 8 hours sometimes, because you want to make sure that they don't have any impairment or injury to their lungs. We can usually tell that with a good physical exam monitoring the child, but sometimes you can develop pneumonia or an other injury to the lungs from inhaling and taking in that water. So what I want you to walk away from today after this video is important prevention strategies of drowning, how CPR differs when it comes to a drowning victim, and lastly, please remember that terms like dry drowning or near drowning are not real terms and they can lead to confusion. If you hear others using it, you can correct them and you can tell them that they can always call it a non-fatal drowning event or a submersion injury. But unfortunately, dry drowning just leads to what I've seen, more anxiety, more panic, and misuse of a term that's really not real. All right, if you have questions, please ask them in the comments below. This is a super important topic. Make sure you save this video. Make sure you share it with others as we head into the summer season. Bye.